Walsh.
Yesterday, in the state of Massachusetts, 77,793 cases statewide. That was an increase from 1,050 from Saturday to Sunday. And the state now has reported 4,979 deaths, up from 139. And those numbers are from Saturday to Sunday. The Boston numbers for today, we have a total of 11,106 cases. That's an increase of 59 from yesterday. And 533 people have passed away, an increase of 8 from yesterday. And I just want to, again, just pass along our thoughts and prayers for those families who lost loved ones and also those families that are struggling with this illness. The Boston Hope Medical Center is currently serving 164 patients, 82 on the shelter side, 82 on the hospital side. Altogether, we have served more than 650 COVID patients at the convention center. Boston hospitals are at a combined 110% of normal ICU capacity. That number has come down somewhat, but obviously it's not where it needs to be yet. And we need to continue to make physical distancing, face coverings, and good hygiene a priority. Some updates on testing. By the end of last week, we had conducted a total of 36,072 tests, or roughly 5% of the Boston population. Our rate of positive tests last week was 20%. Bring our overall positive test rate down to 29%. Every neighborhood saw its positive tests go down, and that's a testament to the physical distancing residents are doing and expanding testing citywide. I want to thank you for that. The neighborhoods with the biggest reductions last week were East Boston, with a 19% drop in positive results, and Mattapan, which had a 15% drop. That's a testament to the hard work of our Healthcare Inequities Task Force, and also the ways we're targeting outreach and testing to our most impacted communities. And as that work continues, I want to thank everyone involved there. I also want to thank the residents in the community who have done some amazing work by practicing physical social distancing, wearing face masks, and doing all the things that are important. I'm going to continue to offer updates today on some of our top priorities, including testing and support for individuals experiencing homelessness, addiction and recovery services for those dealing with substance use disorder, public spaces ideas we are looking at to improve physical distancing, and situations in nursing homes and other long-term facilities. I can start by sharing that our first round of universal testing for the homeless population was completed at the end of last week. We have tested over 2,200 individuals, 735 tested positive, for a 33% infection rate. We've also provided those individuals with quarantine space, support, and medical treatment as necessary. That was an important goal. It was to make sure we could support and care for a very vulnerable population, and also slow the spread overall of the virus. Starting in March, we created hundreds of new beds for that purpose. We secured new sites and increasing spaces in our shelters, and we dedicated 500 medical respite beds for homeless individuals at Boston Hope Medical Center. The result is that severe illness has been kept to a low level and medically vulnerable population. The consensus of those who work in the homeless community is that the impact could have been much worse. So I'm grateful to everyone who worked on this priority. It's a testament to the partnership between city staff and nonprofits like Healthcare for the Homeless and Pine Street Inn, and institutions that stepped up like Suffolk University, Boston University, Northeastern University, and Emerson College. Homeless individuals and families remain a top priority for all of us here in the city. There is more work to be done, including more tests and longer-term shelter spaces as we move forward. We're also working on permanent housing solutions. We're currently helping 1,000 families of Boston Public School students to secure affordable housing using the Boston Housing Authority's rental voucher plan. We dedicated it for this purpose. And when construction restarts, it will make it a priority to create more supportive housing for homeless, continuing the progress we have made towards ending chronic homelessness in the city of Boston. I also want to make sure that everyone is aware of our addiction and recovery services are fully operational. Before the COVID pandemic, we had a substance use epidemic in this country, with Massachusetts as one of the hardest hit states. That epidemic continues today and every day through this crisis. Although we will get through the crisis, it will still be with us. So our staff at the recovery services, led by Jen Tracy and Devin Larkin, have not missed the beat. In fact, they have worked hard to adapt their services to the crisis and conditions. Among the changes they have made, harm reduction services that help active users stay safe have been moved outdoors. Outdoor space at our engagement center was expanded to allow for physical distancing. Our street engagement team has remained very active. We've created comfort stations with bathrooms, hand washing, Narcan for overdose prevention, and many other opportunities. We're actively looking for additional locations. We work with the faith community downtown to help them open up new daytime spaces. Outpatient treatment services moved to a telehealth model and by all accounts are working well for all patients. We're doing universal testing at our residential programs. And we continue to help people who already get into detox and treatment. Finding beds for inpatient treatment after detox remains one of our biggest challenges. It has been for some time now. The bottom line, those with substance use disorder have remained a top priority and will continue to remain a top priority. Public spaces and transportation have been a focus of our response from the very beginning. We started by making sure hospital staff and other frontline workers could get to work safely and affordably, with parking discounts, forgiveness of parking tickets, and free bike share access. We preserved access to open space in our parks while closing facilities like playgrounds, basketball and street hockey courts, tennis courts, soccer fields that bring people into direct contact. We ask people to stay home as much as possible, but at the same time, we want people to be able to get fresh air and exercise safely. We have the best access to parks of any city in the country, and we are drawing on that strength while working to make sure our open spaces don't become overcrowded. But as summer approaches and as the weather brings more people outdoor, and as we prepare for a phased reopening, we want to make sure that we have enough space for safe distancing. We want to make sure our small businesses can get the support they need, and we want to make sure everyone has safe and healthy transportation options. So in addition to our planned capital investment in safe and sustainable streets, we've been looking for ways to expand space for pedestrians, small business customers, cyclists, and bus commuters. The things we are thinking about include expanding sidewalks in business districts that could help with physical distancing, especially where people wait in line for businesses that are following new capacity guidelines. Opening up entire lanes for pedestrians and cyclist use, which could also calm traffic speeds. We would need to do this in a way that does not cut off emergency vehicles or delivery access for residents. And expanding bus stops and making bus priorities on the road. While subway ridership is down, we are seeing essential workers continue to rely on bus routes. If these ideas will help us meet our goals, we will develop proposals for specific locations to share with the community for the feedback before moving forward. This is an important issue for a safe recovery, and we need to have an inclusive conversation to get it right.